Joined by infectious diseases physician and a professor at UQ, Paul Griffin. Thanks so much for your time, Professor. Talk us through, so far so good it seems, in terms of the Pfizer rollout.
Oh, absolutely. I mean, we've seen this vaccine used extensively overseas already, so it's obviously what we expected to see, but it's great to see it finally used in our country, to see people turning up and getting this vaccine. I mean, we know it's safe, and that's exactly what we've seen today.
When you look at the efficacy, it's also incredibly, in terms of stopping illness, it's almost 100%, but in terms of stopping transmission, it's also very effective according to the numbers we've seen out of Israel.
Yeah, look, that's exactly right. I mean, we saw in very large clinical trials that were well conducted, that it looked to protect people to very high levels. And now we've seen the real world experience mirror that. So Israel's a great example. They've collected some really robust data that shows, as seen in clinical trials, that it seems to protect people to a very high degree. It certainly stops people getting really sick and dying. So, it's just amazing that this vaccine is now in use in our country. And, we'll obviously see a lot of benefits from this program.
Paul Griffin, as someone who works in this field, are you comfortable with the way the government and its advisors have put together the phases for the rollout, this tiered rollout?
Oh, absolutely. It certainly makes sense to prioritise it. This 1A phase that we're in right now are people that are at highest risk of acquiring this infection. So that's why those frontline healthcare workers, people working in hotel quarantine, and people in the aged care sector. And then we'll cascade through as quickly as possible other people that not only are at higher risk of getting it, but perhaps higher risk of more significant consequences. And, how quickly we cascade through all these tiers will be really dependent on how quickly people turn up and get their vaccine.
There have been some arguments that there should have been more contracts signed with pharmaceutical companies and those with these vaccines on offer. What's your take on that? And are you confident in the vaccine, the AstraZeneca Oxford University vaccine, that the vast majority of the Australian population will receive?
Yeah, I mean, we needed to have agreements to get these vaccines well before the clinical trials were finished, and to have 3 vaccines for which we had agreements well before the clinical trials are finished that all look very safe and effective puts Australia in a fantastic position. Pfizer, we've spoken about, that looks very safe and highly effective. AstraZeneca is also very safe and highly effective. And while people have tried to compare the two, we haven't done any direct clinical trials comparing them. The AstraZeneca vaccine is very effective. Similar, although not quite to the same degree, perhaps as Pfizer, but again, we haven't done any direct trials comparing that. And then we also have Novavax coming as well, which is a little too soon to call because we haven't finished the clinical trials, but in the data available to date, that also looks very safe and effective. So, it's very likely that in the middle or the end of the year, we'll have 3 highly effective vaccines that we'll be able to use, which will give the highest chance of every Australian getting a vaccine by that October date.
Are you feeling optimistic about the take-up rate? We know that as a nation we've done incredibly well in terms of the vaccination rates for younger Australians. Do you think that this COVID rollout will be a similar trend?
Look, I really hope so. I mean, it's very clear that the benefits far outweigh the risks. I do have some concerns that some people still have reservations and we may not see the uptake we need. And, I just encourage people to make sure they're informed from reputable sources such as the federal and state governments. And, it's really clear that the benefit of this vaccine program will be directly linked to the uptake. So if we have low uptake, then the benefits are not going to be as significant as they could be. So we really need people to come along and get vaccinated. That's very clear.
And so far throughout the pandemic, we've seen quite a lot of discipline and civic duty on show by the Australian people, I think. So hopefully that, again, is on display when it comes to the vaccinations.
Yeah, that's exactly right. I mean, on the whole, Australians have done a fantastic job at controlling this virus, and that's why we've got the amazing results that we've seen. And, we need to make sure that people do realise, though, that this virus hasn't gone away, or we've got it under excellent control. If we take our foot off the pedal and get complacent, it will come back. And so that's why we need to keep up some of these mitigation strategies and all turn up and get vaccinated. Then hopefully we can roll back some of the mitigation strategies that have been quite challenging, to be honest, like border restrictions and snap lockdowns, for example. So if people want those to go away, then they need to come and get vaccinated.
And Professor Griffin, once the vaccination rates are hit that are desirable to try and push back against the disease, how soon do you think we get back to some pre-COVID normality where this virus becomes somewhat like the flu as opposed to this pandemic we're facing?
It's a really hard question. It's really challenging to give an exact date, and obviously how quickly we can start to relax some of those harsher restrictions is entirely dependent on how quickly people come and get vaccinated. I mean, it will take some time, and we are going to need some ongoing mitigation strategies in parallel, probably for a long time moving forward. And what that might look like is things like hand washing and a little bit of social distancing, but importantly still having very high rates of testing so we can find cases if there are still some in the community and make sure we more specifically isolate those people than using more broad restrictions. But I think we'll notice a slight difference fairly quickly after the vaccine rollout really ramps up, but it's going to be challenging to really see those benefits in our country because our control is already so excellent. But as I say, when the uptake is high, hopefully we'll see fewer cases escape from hotel quarantine and a far lower reliance on those harsher restrictions like border lockdowns and those snap lockdowns that we've seen.
Professor Paul Griffin from UQ, thank you so much. Infectious diseases physician Paul Griffin. Talk to you soon.
Thank you.